I feel physically completely strong and emotionally completely exhausted.
A nurse held in quarantine in New Jersey is on her way back home to Maine tonight. Doctors say she does not have any symptoms of Ebola. Good evening, I'm Pat Callahan.
And I'm Cindy Williams.
Casey Hickox is being taken to Fort Kent after being declared symptom-free for 24 hours.
Hickox was quarantined on Friday after returning from working with Ebola patients in West Africa. Hickox became the first person forced into the state's mandatory quarantine. She was held against her will in a tent inside a wing of a New Jersey medical center. Hickox threatened to sue if she was not released. Newsletter's Caroline Cornish tells us what she'll face once she arrives at her boyfriend's house in Aroostook County. Caroline?
Pat and Cindy, officials at the University of Maine in Fort Kent, as well as Northern Maine Medical Center, say they are ready should Hickox or anyone else show symptoms of Ebola. But right now they stress there is no reason for anyone to be concerned.
Here are a few important facts about the Ebola virus from the Centers for Disease Control to keep in mind. Ebola does not spread through the air. It is transmitted by direct contact with the bodily fluids of a person who is sick with symptoms. Ebola can only be spread to others after symptoms have begun. Symptoms can appear from 2 to 21 days after exposure. After 21 days, if an exposed person does not develop symptoms, they will not become sick with Ebola. And we have more facts about the Ebola virus on our website, WCSH6.com. The news of Casey Hickox traveling to Maine after her quarantine in New Jersey is sparking both criticism and fear among some Mainers.
It is evident through some of the comments on our Facebook pages. Here's an example. Julie writes, "The reality is that if she sneezes at the gas pump, you are next and touch your eye, nose, or mouth after, you can get a non-airborne illness. It can live on a surface for at least 24 hours. The fact is, according to the Centers for Disease Control, Ebola is transmitted by direct contact with the bodily fluids of a person who is sick with symptoms. Hickox does not have Ebola. She has no symptoms of the virus. Again, you have to be sick in order to transmit it. When it comes to touching common surfaces, Ebola can survive for only a few hours on dry surfaces like doorknobs and countertops. When it dries, it dies. It can be killed with household bleach or alcohol-based hand sanitizers. We have more facts about Ebola on our website under Facts, Not Fear.
I am not going to sit around and be bullied by politicians and forced to stay in my home when I am not a risk to the American public. We know that
despite a threat of legal action by the state of Maine, nurse Casey Hickox says she will no longer cooperate with a voluntary quarantine at her home in Fort Kent. State health officials have now issued a response to Hickox's plan to go against what they consider to be the safe protocol for anyone who has had contact with people who have Ebola. Good evening, I'm Pat Callahan.
And I'm Cindy Williams. Casey Hickox remains in her Fort Kent home this evening under voluntary quarantine. Earlier today, her boyfriend, Ted Wilbur, who is also under voluntary quarantine, came out of the house to meet with a state health care monitor. The monitor arrived at the house to take Hickox's temperature. All of the windows are boarded up at the home. State police are sitting outside in an unmarked car to report Hickox's whereabouts to the Maine CDC.
News Center's Caroline Cornish is here now with more on the state's response to what Hickox plans to do. Caroline?
Pat and Cindy, DHHS Commissioner Mary Mayhew said at a news conference earlier this evening that the state is now attempting to get a court order to force Casey Hickox to self-quarantine for the full 21 days. Mayhew said that the state had hoped to make this a voluntary quarantine, but it certainly doesn't sound like she intends it to be voluntary now. Mayhew acknowledged the state would not be able to take Hickox into custody for violating the quarantine without a court order from District Court in Fort Kent. In the meantime, Hickox is being monitored by the CDC, and she is in contact with state officials.
Staying at home for the duration of this 21-day period, November 10th being the last day, does not seem like a burdensome request to ask in order to provide, out of an abundance of caution, a protection to her and to the individuals of this state, and certainly to those who are in that region of the state.
Mayhew also took a shot at the federal government tonight, saying there is a lack of leadership at the federal level when it comes to this issue, and that's why the state is going above and beyond federal CDC guidelines. Pat and Cindy?
All right, Caroline, thank you so much. Casey Hickox arrived in Fort Kent late last night. This morning, she spoke to Matt Lauer via Skype on the Today Show about her situation since returning from West Africa.
Hickox maintains she will self-monitor herself, but she will not comply with Maine's quarantine order. Here in her own words are excerpts from her interview for the Today Show explaining why.
Organizations like mine, Doctors Without Borders, have for a long time had reasonable steps in process, which is really self-monitoring, taking your temperature twice a day, understanding that if you develop symptoms, you need to be tested, specifically a fever and some of the more general symptoms. And these policies have worked in the past. I think we need a couple of things. I think we need more education about the disease, and I think we need to not be taking these mixed messages from politicians. But I do think there's a compromise. I don't think it's being met right now because currently I'm the one that's suffering. I do understand that it has created a lot of fear, but we still have to make policies based on evidence. I don't plan on sticking to the guidelines. I remain appalled by these home quarantine policies that have been forced upon me, even though I am in perfectly good health and feeling strong and have been this entire time completely symptom-free. I truly believe that this policy is not scientifically nor constitutionally just. And so I am not going to sit around and be bullied by politicians and forced to stay in my home when I am not a risk to the American public. If the restrictions placed on me by the state of Maine are not lifted by Thursday morning, I will go to court to fight for my freedom.
That's Casey Hickox on the Today Show. And she worked with Doctors Without Borders while overseas. She worries that quarantines on healthcare workers returning to the United States from West Africa will have a chilling effect on volunteers. Doctors Without Borders supports Hickox's decision not to stay quarantined, saying, quote, "It strongly disagrees with blanket forced quarantine for healthcare workers returning from Ebola-affected countries." It also says it respects Casey's right as a private citizen to challenge excessive restrictions that are being placed upon her.
A reminder, on our website, WCSH6.com, we have a special section called Facts Not Fear that will help guide you through some of your questions about the Ebola virus and how it is spread.
She came out of her house to speak with reporters this evening. News Center's Grady Trimble was there and joins us now with the latest. Grady?
Yes, Casey Hickox and her boyfriend Ted Wilbur stepped outside for about 15 minutes or so at around 7:30 this evening. Hickox issued a brief statement and then answered questions for reporters. She continued to reiterate what she's been saying since she returned to the United States, that she hasn't agreed to the 21-day quarantine period and that she will take legal action if she has to.
We have been in negotiations all day with the state of Maine and tried to resolve this amicably, but they will not allow me to leave my house and have any interaction with the public, even though I am completely healthy and symptom-free. I don't want to hurt anyone in the public, but I don't think this is an acceptable line to be drawn. I'm not promising what I'm going to do right now. It's been a long few days, but I have not committed to staying in my house and agreeing to an in-house quarantine that I believe is not scientifically valid. And I have been told that the Attorney General's intention is to file legal action against me, and if this does occur, then I will challenge those legal actions. There are things that we know work, and all aid workers are willing to do those things, but I'm not willing to stand here and let my civil rights be violated when it's not science-based. I'd love to be able to go to the Moose Shack in Fort Kent and get an amazing slice of pizza, and again, not be worried about what people are thinking or if I'm going to get arrested by the state trooper if I walk outside of my property. We have to make decisions on science, and I am completely healthy. You could hug me, you could shake my hand. There is no way that I would give you Ebola for being here.
Thank you. I'll shake your hand.
Oh.
In fact, one reporter did go up to Hickox after the interview to shake her hand. Hickox says she'd like to find some common ground with the state. If that means staying strictly in the Fort Kent area, she says she'd be willing to do that. But for now, there's been at least one state trooper outside her house monitoring the area throughout the day. I'll be here through the night and bring you the latest as it happens. Pat and Caroline.
All right, thanks a lot, Grady. The state of Maine is prepared to go to court if Hickox does not comply with the 21-day quarantine. And as News Center's Don Kerrigan reports, there is nothing voluntary about that quarantine.
The Department of Health and Human Services rules call for people who've been exposed to Ebola patients to voluntarily quarantine themselves for 21 days. But Commissioner Mary Mayhew made it clear late this afternoon the rule really isn't voluntary.
This individual has come out and announced that she no longer intends to voluntarily comply. We, out of an abundance of caution, need to be prepared to enforce this protocol.
Mayhew says nurse Casey Hickox had complied with the rules so far, including twice-a-day monitoring of her medical condition. Mayhew would not say if Maine CDC staff had checked the woman personally today. But she also suggested they don't totally trust the information they get from Hickox herself.
We have been trying to work cooperatively with her. There are concerns about the lack of reliability and the lack of trustworthiness in the information that has been received.
Mayhew says that's one more reason why the state is seeking a court order to force the nurse to stay in her home. And it's why they have even parked a state trooper outside her house.
We have no authority outside of a court order to arrest her. We will, however, monitor her until such time as we have that authority.
Mayhew says the state wants to know if Hickox has contact with anyone during the quarantine period. And the commissioner said she just doesn't understand why the woman won't follow the state's rule. That may be the issue that gets settled in court. In Augusta, Don Kerrigan, News Center.
The organization that Hickox was working with in Sierra Leone, Doctors Without Borders, strongly disagrees with what it calls blanket forced quarantine. In a statement today, it says Casey Hickox has carried out important life-saving work for the organization in a number of countries in recent years, and we're proud to have her as a member of our organization. It goes on to say Doctors Without Borders respects Casey's right as a private citizen to challenge excessive restrictions being placed upon her.
It has been a relatively quiet day here at the house until just a few minutes ago. There is a car that's still outside the house right now. It pulled up just a few minutes ago. A younger looking blonde woman stepped out of the car. She walked up to the house and she is still inside right now. There is no indication of who this woman is and what relation she has to the two people who live inside the home, Casey Hickox and her partner Ted Wilbur. Aside from that visit today, they also got a pizza delivery at around 4 o'clock this afternoon and a visit from a CDC worker, but nothing compared to the frenzy that was surrounding that bike ride this morning. Casey and her partner Ted Wilbur left their home around 9 o'clock this morning. They went for a short bike ride around the neighborhood and along a gravel trail, followed the entire time by state police. At times they did slow down to talk to reporters. At that time, Hickox said she had not spoken with her lawyers or anyone from the state.
I sure haven't. Nope, we're still waiting to hear from the state of Maine to see what they want to do. I hope that we can continue negotiations and work this out amicably.
Again, since that bike ride, Casey Hickox has not left the house. Again, she has a visitor inside right now. We don't know who that person is. She also received a pizza delivery and a visit from a CDC worker. The state troopers we mentioned before are still parked right across the street. Governor LePage saying earlier they are there as much for Casey Hickox's safety as for the public's. Pat, Cindy.
All right, Sarah DeLage, thank you so much.
And here's the general sense of things we've been hearing, that since she's been back in northern Maine, they say Hickox's behavior appears to be, for example, ludicrous and insidious. However, a small number of people believe that Hickox's rights may have been violated. Regardless of that, they feel she's reacting the wrong way.
You know, I was very supportive of the fact that she, the conditions she was in New Jersey, I didn't think were good. I thought they infringed her rights. However, now I think maybe we need to keep in mind that the people in, Fort Kent and this community aren't quite as knowledgeable as maybe she is.
We're dealing with a whole community, not just one person here that is completely terrified. Some say it's not a big deal, don't worry about it, don't get stressed about it. It's still kind of nerve-wracking.
Something that people in Fort Kent seem to agree on is that they're shocked by all the attention that Kaci Hickox is getting from health officials, politicians, and the news media. The director of the American Civil Liberties Union in Maine discussed Hickox's case today. She says Hickox is complying with federal CDC guidelines and that it's important that the government does not overreact in this situation.
There are clear legal standards here about when someone can be quarantined, and Ms. Hickox is following proper medical procedure, and she does not pose a clear or imminent threat, which is what the state would have to show to impose this quite significant violation of her liberty.
Allison B.A. says the ACLU does not believe that state law would allow the governor to quarantine Hickox at her home. Speaking of the governor, Governor LePage said today that negotiations aimed at reaching an agreement with Hickox have failed despite repeated attempts by state officials to work with her.
Rather than having Hickox quarantined in her home for 21 days, as was first suggested, the governor said he would accept the CDC guidelines for those in the some risk category. He says that would allow Hickox to go for a walk, a run, or a ride, as she did today. She would be prevented, though, from going into public places and coming within 3 feet of other people.
Right now, she can come out of the house if she wants, but we can't protect her when she does that. The reason there's a police car there is to protect her more than anybody, because the last thing I want is for her to get hurt. But at the same token, her behavior is really riling a lot of people up.
The governor says if Hickox does attempt to go into a public place, state law provides robust authority for the state to address it. He would not comment on any specific legal steps that the state has taken or will be taking. A compromise over voluntary quarantine is reached in the battle between nurse Kaci Hickox and the state of Maine, but Governor LePage remains frustrated over the decision. The Ebola issue is just one of the public health matters on the governor's plate. There is also a hepatitis A infection in Cumberland County and the possibility that others may be infected. Good evening. I'm Cindy Williams.
And I'm Pat Callahan. First, the latest on the nurse in Fort Kent. There were 2 court orders issued in the case today. The first laid out 7 guidelines. One banned Kaci Hickox from going into public places or workplaces. Another ordered her to stay at least 3 feet away from other people.
A few hours later, a new court order removed most of those restrictions, allowing her to be out in public and wiping out that 3-foot rule. NewsCenter's Chris Rose joins us live now from Fort Kent with more on what today's decision means and reaction from Kaci Hickox herself. Chris?
Just moments ago, Kaci Hickox and her boyfriend just came back from a short walk down the street. It is the first time they left the property all day. Now, Hickox will not be prohibited from places where other people are gathered, which is what the state wanted. Instead, a judge ruled that she must participate in and cooperate with direct active monitoring. She must also coordinate her travel with public authorities, and she must immediately notify public health officials and follow their directions if any symptoms appear. Now, this afternoon, Hickox did come out of the house and just into her driveway, where she spoke with reporters as she responded to that ruling. In the ruling, the judge seemed to applaud her while at the same time warning her. In his observations of the court, Judge Charles DeVerdia wrote, Hickox acted kindly and with compassion, caring for individuals stricken with a terrible disease. But he went on to say, even if people's fears are not entirely rational, the fear is real, and Hickox's actions need to demonstrate her understanding of that. Today, Hickox says that she does understand that.
I completely understand that, and I am sensitive. This is one of the reasons I'm saying this battle isn't over. We still need to continue this discussion. We still need to continue educating ourselves, and I don't want to make anyone uncomfortable.
Are you satisfied with the decision by the judge today?
I am very satisfied with the decision. The 3 points that he is still recommending that I abide by are 3 points that I believe is part of this good compromise that we can make.
Maine Attorney General Janet Mills issued a statement today saying she is pleased that a well-respected member of the Maine judiciary crafted an order based on medical science. Now, Governor LePage at times had expressed frustration with Kaci Hickox's actions the past few days. He is not happy with the ruling, and this is what he had to say today.
She's violated every promise she's made so far, so I can't trust her. I don't trust her. And I don't trust that we know enough about this disease to be so callous.
Now, Hickox was asked about comments that Governor LePage has made about she was not acting smart and she was riling people up. She said she really didn't have any comment on anything that the governor has said. Now, she is still a focus of attention here in Fort Kent. There is concern for her safety still, especially now since she's out and about. And the situation with police watching over has changed. Grady Trimble is covering that part of the story. Grady, the police situation, state's gone, local are in.
Yeah, that's right. Once the final court order was issued, making Hickox free to come and go as she pleases, the state police left. And as you mentioned, Chris, some people in the area are still concerned that Hickox is here, so it's now up to the local police in Fort Kent to protect them. I spoke with Police Chief Tom Pelletier today. He's aware of the hateful comments toward Hickox, especially on the internet, but he says there are no credible threats right now, and if there were one, the police here would be prepared to deal with it.
It's a concern of ours, and we want to mitigate some of those safety issues by providing somebody here to help them out if in fact they do decide to go for another bike ride. Then hopefully we can coordinate with them to provide some security for them.
And Wilbur has been talking to reporters quite a bit this evening, and he says he's not planning on going into town and he wants to respect the people in Fort Kent. Reporting live in Fort Kent, Grady Trimble, News Center.
All right, thank you, Grady. The story started to unfold a week ago. That's when a plane from West Africa landed at Newark International Airport. A forehead thermometer initially showed Kaci Hickox had a fever. She said she was merely flushed and upset. Later that day, she was moved to a hospital and placed in quarantine. An oral thermometer showed she did not have a fever. Last Saturday, a preliminary test showed she was negative for Ebola. New Jersey's health department said Hickox would remain in quarantine, but on Monday, the New Jersey governor's office announced Hickox would be discharged. Later that day, she left New Jersey to head to Maine. On Tuesday, it was confirmed that Hickox arrived at her boyfriend's home in Fort Kent, kicking off a battle between the state and Hickox over quarantine restrictions, which would have put personal freedom versus public health in the spotlight. Kaci Hickox and the subject of Ebola have been getting a lot of attention in Maine this week, but there is another public health threat that the Maine CDC is dealing with.